A doctor can tell so much about what's going on inside you just by feeling around on the outside? Well, it's not magic, I can tell you that. They're actually using a secret map, a series of landmarks that are written right onto your skeleton. And today, we're going to decode that map.
So really, how do they do it? When a doctor puts their hands on your chest or your shoulder, how do they know exactly what they're feeling? It's not just guesswork, they are following a super precise set of directions that are literally built into your own body. And here's the secret. It all comes down to a series of anatomical landmarks. These are just specific points, bumps, ridges, and joints that you can actually feel right through your skin. Each one is like a little signpost that tells a doctor exactly where they are and, more importantly, what crucial stuff is lying just underneath.
Okay, so our first stop on this little tour is a small ridge on your chest that I like to call a bony speed bump. It might not seem like a big deal, but it's one of the most important starting points in pretty much any physical exam. So picture this. A doctor needs to listen to your aortic valve. You're lying on the table. The heart is totally hidden away. I mean, where do they even begin to place their stethoscope? Well, the very first clue is finding that bony speed bump.
This landmark is called the sternal angle, or sometimes the angle of Louis. Go ahead, you can feel it on yourself. If you run your finger down the middle of your chest from your neck, you'll feel it, this little bump. That's where the top part of your breastbone connects to the main body. For any doctor, this is basically ground zero for a chest exam. And what's wild is just how much is happening right at this one little spot. I mean, first off, your second rib attaches right there, which makes it the absolute perfect place to start counting all the other ribs. Then the aorta, your body's main pipeline for blood, it arches over right at this level. And get this, your windpipe, the trachea, splits in two right here, branching off to each lung. It is a major, major anatomical crossroad. So let's put it all together and solve our doctor's problem. Okay, they start at the jugular notch, that's the soft dip at the base of your neck. They slide their fingers down till they feel that ridge, the sternal angle. From there, they just move out to the side to feel the second rib. And the space just below it, that's the second intercostal space. Intercostal just means between the ribs. And boom, that's it. They place the stethoscope right there and they can listen perfectly to the aortic valve. Problem solved. Simple, right? All right, now that we've covered the chest, let's move on up to our next landmark, the collarbone, or as it's officially known, the clavicle. The best way to think about it is like a strut, or maybe a tent pole for your shoulder, holding everything up and out. But this really important strut has a bit of a weak spot. So here's a classic situation. A rugby player takes a hard fall, lands right on their outstretched hand. They get up, they've got some serious pain, and there's this visible bump right over their collarbone. What in the world is going on here? Well, the anatomy of the clavicle is going to give us all the clues we need. Like we said, the clavicle's main job is to be a strut. It literally pushes the shoulder joint out and away from the center of your body. If you didn't have it, your arm wouldn't be able to swing so freely. It is the one single piece that connects your entire arm to the rest of your skeleton. It's that important. So when that strut snaps, it's like a game of tug of war breaks out between your muscles. You've got this powerful muscle in your neck that pulls the inner piece of the bone up. And at the exact same time, the weight of your arm and your big chest muscle pull the outer piece down. And that is what creates that telltale bump our rugby player has. It's anatomy in action, plain and simple. Okay, so from that weak point in the middle of the clavicle, let's follow it inward to where it meets the sternum. This little spot is the sternoclavicular joint, or SC joint. It's the only bony connection between your entire arm and your torso. And because of what's hiding right behind it, an injury here can be incredibly dangerous. And this brings us to a much, much more serious situation. A patient comes in from a car crash with chest trauma. You look at the base of their neck, and it just looks uneven. And they're telling you they're having trouble swallowing. These aren't just signs of a broken bone anymore. These are massive red flags for a life-threatening emergency. The huge concern here is what we call a posterior dislocation, where the end of the clavicle gets shoved backward into the chest. And why is that so bad? Because it can literally crush the vital stuff just behind it. We're talking your windpipe, your esophagus, and major blood vessels. That's why the emergency response has to be so fast. Check breathing, check blood flow, get them to imaging immediately, and get the specialist on the phone. This is a true, no-kidding medical emergency. So, we've looked at a few individual landmarks now. But the real skill, the thing that makes a great doctor, is connecting them all. To think like a physician, you have to see how all these points create one big, integrated map of the human body. Let's do a little quickfire round to really lock this in. Sternal angle? That's our go-to landmark for the T4 to T5 level, right? Absolutely essential for counting ribs and finding those heart valves.
What about the middle third of the clavicle? Yep, that's the most common fracture site, because it's the weakest point in the whole strut. See? Every single point on the map tells a critical story.
And that, right there, brings us to the most important point of all. Anatomy isn't just about memorizing a bunch of names and places from a textbook. The real key to clinical thinking is constantly matching those structures with what they actually mean for a patient's health. It's all about knowing why each of these landmarks matters. So let's end on this thought. A biker goes down, hurts their shoulder. You're the first person on the scene. Knowing what you know now about this secret map, what's on your mental checklist? You're not just seeing pain anymore. You're seeing a whole network of struts and joints and critical structures underneath. So the next time you feel that little bump on your collarbone or that ridge on your chest, just remember, you're not just feeling bone. You are feeling a landmark on a secret map, a map that holds the keys to understanding your own health.